Hi, Dr. Bill Davison here. Welcome to our webinar on the how to balance your hormones naturally and without drugs. So we're also going to talk about the 4 hidden factors to balancing your hormones. Now, just to make sure that you have sound and have visual, in the little sidebar down on the side, your right-hand side, if a couple of you could just indicate in there that yes, you're receiving me loud and clear, that you have sound, and that you have video. So you have visual and you have sound. And it takes a few moments before you type it in and when I receive it. So while I'm waiting for that, I just want to thank you for taking the time to be with me on this webinar, and I am anticipating that you're going to get a lot of valuable information from this that you can use. And if there are any men or males in the audience, please make sure the woman or the women in your life actually get to watch this perhaps on the replay. Now, when I say women, I don't mean that you would have more than one wife, because as some of you may or may not know, I had 9 children, and 8 of them were female daughters. So you can imagine how all the hormone issues were going on as they were hitting puberty and on. So it was quite interesting to live with 9 women. Obviously, that includes my wife. So I have a little bit of an idea of what it's like to experience hormonal imbalance from the outside, not from the inside. So obviously, being a man, I don't really know what it's like. So I just want you to know I've had experience in that way. Yes, I've got some confirmations coming in that we have visual and sound, and so thank you for that. I really appreciate it. Don't want to be talking to myself. So let's commence. Let's get on with the show, as they say. So, as already mentioned, this is going to be a webinar on how to balance your hormones. And I'm just clicking PowerPoint now. And here we go. How to balance your hormones naturally without drugs. My goal in doing this is to help you avoid the misery associated with unbalanced or imbalanced hormones. And I'm sure that a lot of you can identify with that. Now, if you stay to the end, it will actually achieve my goal for you, and you will enjoy all the benefits that balanced hormones can produce. I want to provide some bribes, some bonuses, and free stuff to help you achieve your personal goals that you have for balancing your hormones. Now, what makes this different? What I'm going to share with you. Well, I've had experience in my practice of nearly 40 years in discovering what works and what doesn't, including things that are known, things that are unknown, and things that are in between. So I've done that 40 years, and I've seen a lot of female patients who've had problems with their hormone balance, and I've worked a lot in discovering ways to help them with that problem in those 40 years. My name is Dr. Bill Davison. I'm a chiropractor, an osteopath, naturopath, a holistic health practitioner, a lecturer, a holistic health master coach, and an author. And I'm going to reveal some awesome things in this webinar. I think they're awesome, so I hope you're interested. Now, I have tried a lot of things, and I guess that's often how we learn, through trial and error. and I want you to know the things that didn't work or didn't work very well. Then in my practice, I discard them and I only use and maintain those things that I feel give me the best results. Now, you could do it the hard way yourself to try to balance your hormones by, as we said, trial and error, which is what I went through, and you could do the same. And or drugs. You can use drugs. Now, you have two options to you there, which are not great options. Now, I discovered this the hard, long way. You get the opportunity to cheat if you like and do it the other easy way based on my experience. So do you want that easy way that I've discovered from all my years in clinical practice? Now, the results, this is a legal disclaimer I have to make. Results are not typical. That means just because something works for one person may not necessarily work for another. So this information is for educational purposes only. The application is your responsibility. So that's the legal side out of the way. Now, what do we already know? I'm sure many of you remember that with hormone replacement therapy, that is by using things like Premarin, which stands for pregnant mare's urine. That means a horse. That research found that there were some side effects, which I think you already know that there's side effects. But one of the big side effects that was found is that they believed it did increase the risk of breast cancer. And this sent a great big ripple through the whole medical and pharmaceutical community, because there were so many women that were taking HRT, and they were told if they didn't, they stood the risk of obviously osteoporosis, because when you don't have enough estrogen in your body, it could affect your bone density. So the huge ripple went through not only the public, but also the medical and the pharmaceutical community, because they'd been prescribing hormone replacement therapy and extolling its benefits for quite a number of years. So this it was quite embarrassing, and a lot of people started to panic. Now, what you may not already know is, why do other seemingly unrelated problems get worse just before the period or menstrual cycle? Can you still balance hormones naturally if you are on the contraceptive pill? Well, let me answer that second one now, and that is it's more difficult to balance the hormones naturally, but you can still actually improve the symptoms of the imbalanced hormones. If you're on the contraceptive pill, you can actually still help. Next question, are there other hormones apart from the reproductive system hormones? And you're going to find that out as we go through the webinar. And also, what are hormones made from? Which will actually answer that question now. The reproductive system hormones are actually made from cholesterol. Now, what's interesting, of course, is that there's a big push to reduce what may be considered high cholesterol in the body. Now, this is not a webinar on cholesterol, but as you'll see from other things, the levels of cholesterol can affect your hormone balance, because if your cholesterol drops too low, then you don't have the raw materials that you need to produce your hormones. Now, there are a number of kinds of cholesterol: HDL, or high-density lipoprotein, and LDL, low-density lipoprotein. The high-density lipoprotein is considered the good one. The low-density is considered the bad one. Now, when we say bad, we have to qualify what we mean by that. The low-density lipoprotein is there for a reason. It does perform a function in the body, but it has to be kept under control. And that's the job of the HDL, or the lipoprotein. And it's considered that if you have 1 part good to 4 parts bad, in inverted commas, then the good can control the bad. And remember, the bad does have a positive use, it does have a good use, but if in excess is when it creates problems. So we have the good controlling the bad, but not necessarily the ugly. But we won't go into that one now. When you get a cholesterol blood test done, often it gives you the total, but it doesn't give you the ratio. So anything, over 5 or 6 is considered too high. And the doctors will immediately suggest you actually take a cholesterol lowering drug. Now, there are often side effects from that, including muscle and joint pain from cholesterol drugs. So if you're in that category, you may want to look at that. Let's just take an example. Let's say your reading was a 7. And let's say you had 2 parts good to 5 parts bad. And that's a ratio of, if you break it down, to 1 to 3, 1 good part to 3.5 bad parts. So I said if the total was 2 good and 5 bad, you simply, that's 2 over 5, which is the same as 1 over 3.5. So that actually is good, because you only need 1 part good to 4 parts bad, and you've got 1 part good to 3.5 parts bad. So that 7 is really a misrepresentation of the true picture. So even though obviously the total is important, it's not as important as your ratio. So always discuss ratio with your medical doctor or your alternative health practitioner, and we do that a lot in the clinic. Now, the danger is if you bring your cholesterol levels down too low, it could affect your production of your hormones. That's the main point I wanted to get. Okay, moving on. Now, there are other types of hormones, such as stress hormones and kidney function hormones. The reproductive hormones are made in the adrenal glands when the ovaries retire. Those other 2 hormones are also made in the adrenal glands, which we'll get to in a moment, the importance of that. Now, the adrenal glands then are multifunctional. They're a tiny little gland, about the size of a, 20-cent piece, that sit on top of your kidneys. Tiny little gland. And yet they're responsible for helping your body to deal with stress. They also help your kidneys to function by regulating your electrolytes, whether you retain them or whether you release them. So your electrolyte function, which influences muscle and nervous system function. So you can see how the adrenal glands, through the kidney function, can influence even your nervous system and your muscular system. And the reproductive system hormones are also released in the adrenal glands when you've gone through menopause. I was going to say when you're going through menopause. Now, why menopause can be such a problem for many women is the fact that if your adrenal glands are also overworked because you've been under prolonged stress, then they can be weakened, especially if your stress has been serious and prolonged. Then your adrenal glands are compromised, and when you go through menopause and they're asked to take over the role of the ovaries to produce the reproductive system hormones, then they may not be able to carry that extra workload. And so then you get the effects of not having enough estrogen or progesterone or whatever other reproductive system hormones the adrenals is meant to produce to make up for the ovaries retiring or closing down or shutting down for business. So the adrenal glands may not be able to carry that extra workload, and so you get all of those negative effects that comes from the drop in your reproductive system hormones. So that's really important to see that connection between stress and menopause. Now, some of the problems associated with hormonal imbalance, and some of these are obvious and some are not. Premenstrual tension, menopause, which we've mentioned, infertility, miscarriage, fluid retention, increased weight, change of body shape, bloating, skin quality, hair loss, libido, erratic, heavy or painful periods, energy levels, cravings, mood swings, headaches, migraines, and others. So that is quite a list, and you can have any one or more of those symptoms from your hormonal imbalance. So the 4 secrets to balancing your hormones. Number 1 is the liver. You might be thinking, why is the liver important in my hormonal balance? Well, let's reveal that secret in a moment. Secret number 2 is your pituitary gland, and we'll get to that one too. And number 3, hyperinsulinemia. I can't say it, which is high blood insulin. Hyperinsulinemia. There you go. I got it. You try it. And number 4 is stress, which we've already alluded to. So let's go to number 1, the first secret, the liver function. And there's a graph I want to show you, a very important graph. And I don't want to get too bogged down here, but it's so important, I want to explain this to you. On the left-hand side of your diagram, you'll see something called estradiol. Now, estradiol, there's basically 3 types of estrogen in your body, but the estradiol is the main one. So that's the one that's mainly focused on. So you can see that's the amount of estradiol on the left side, from 200 to 800. Along the bottom line, from 0 to 0, you'll see that is actually the length of the menstrual cycle, which on an average is 28 days, but of course it does vary from female to female. So you can see the amounts of hormones in your blood at different times of the month. So where you see that dotted line in the middle, that's obviously the middle of the month, approximately when you ovulate. So you can see the estradiol goes up very, very high just before you ovulate, and then it drops dramatically during ovulation. And there are reasons for that, but we don't have to go into that. That's actually, the estradiol is actually preparing your body for pregnancy. That's its purpose, the estrogen is to do that. Now, you'll see that the progesterone down the bottom is almost non-existent, and then just at ovulation, it starts to rise, it starts to go up, which again is actually preparing your body in case you have become pregnant. And you can see how the estrogen drops and then comes up again on the second part of the month or the menstrual cycle, but it's a lot less than the progesterone. Now, the significance of this diagram is that it's not just the amount of estradiol and progesterone in your body, but it's the ratio and also the time of the month when you're releasing it. Now, that is partly not just a function of the ovaries, but it's partly the job of the liver. So, the liver actually is a manufacturing and a dismantling factory for all of the molecules in your body, including your reproductive hormones. But doesn't the ovaries make the reproductive hormones? Yes. What the liver does is it prefabricates the molecules. In other words, it actually makes them up a little bit in pieces or in parts, and then the ovaries actually does the final assembly. And so your liver fabricates or pre-manufactures the reproductive hormones, and then the ovaries put them all together, put the final touches. The other important thing is when you need to reduce your estradiol, where does it go to? How does that just disappear magically, waving a magic wand? Same as the progesterone. That's the job of the liver. The liver monitors all this, and your liver actually then, when the estradiol or the progesterone needs to drop, then the liver actually dismantles it. Fascinating. So that's the job of your liver. It dismantles those, and it helps to keep that, not only the amount, but the balance between the two. And this is critical. So how do we make sure the liver's doing its job? One of the best things you can do for your liver is obviously detoxification. And we had a whole webinar on that recently, and you can go to my website, drbilldavison.com, and watch that, and I recommend that to you. What also helps the liver is juices, in particular carrot and beetroot are very good to detox your liver. Also, lemon juice is very good for detoxifying your liver. So you can make up a veggie juice consisting of carrot, beetroot, and about half a beetroot, not a lot of beetroot, can't do too much. Carrot, beetroot, kale, celery, and some lemon juice. Or you can, if you want, you put a little bit of apple in there if you would like to. So that's something you can have every day, either as a meal replacement or first thing in the morning. And also if you're doing detoxing, juices are very important. There's also certain foods that help your liver too. As we mentioned already, lemon juice, the liver likes, and beetroot, whether in a juice or in your food. The liver does like raw fruits and vegetables, which it functions very well on. Also, the liver benefits from certain nutrients, which we'll get into in a moment. So, that's the liver. Secret number 2, your pituitary gland. So, the pituitary gland is considered the master gland of the body. It's like the conductor of the orchestra. It tells when the violins to come in, when the brass to come in, when the drums. So the pituitary gland helps to regulate all of the different glands in your body. And to give you an example, it releases something called the follicle stimulating hormone. What that does, that stimulates your ovaries to produce the reproductive hormones when the time is right. So there's a little chemical messenger, leaves the pituitary gland, which sits right at the bottom in the middle of your brain, and it releases it in the bloodstream. This little chemical takes a message down to the ovaries saying, hey, you know, we need to release some reproductive hormones. So that's the job of the pituitary gland. It also releases a little hormone called the thyroid stimulating hormone, which tells your thyroid when it needs to increase its production, and something called ACTH, which is the adrenocorticotropic hormone, which actually sends a message to your adrenal glands when it needs to secrete its hormones, whether they be, that's usually for stress hormones, because there's a different one for your kidney function, but we don't need to go there. Now, what controls the pituitary gland? Actually, that's the job of the hypothalamus, to control your pituitary gland. And what influences the hypothalamus? Your emotions, whether they are conscious or subconscious, that can actually influence your hypothalamus. And that's why we have something called an HPA axis. An axis simply means how a number of different parts work together. So you have the hypothalamic, pituitary, adrenal gland axis, how they all work together. But you can see how the emotions then work down through into your adrenal glands. Now, what influences your hypothalamus, apart from the emotions and your pituitary gland, is the movement of the bones of the skull. Because the movement of the bones of the skull, or the lack thereof, affects your cerebrospinal fluid. And it can actually, for other reasons, can actually influence the function of your pituitary gland and your hypothalamus. So if you have a restriction of the movement of the bones in your skull, it can actually influence brain function as well as the pituitary gland and hypothalamus. What can cause the restriction of the bones of the skull, the restriction of movement there? It can be an accident or a shock or stress or tension can do that. And that can be remedied with cranial therapy. Actually, super green foods are nourishment for the pituitary and the hypothalamus. Anything that has particularly barley green is a good one. Spirulina is another. Chlorella. Any of these what I call super greens can influence those. That's why you need them in your juice, like your kale. Also, amino acids influence the brain function, because the amino acids, which are simply the building blocks of protein, they provide the raw materials for the neurotransmitters, the little chemical messages in the brain, and they're made up from amino acids and trace minerals. Boring? Now, well, we'll keep going. Secret number 3, high blood insulin. Now, why would you get high blood insulin? Well, hyperinsulinemia, that word again, can't get rid of it. When you have too much sugar in your blood, or when your sugar levels, or should we say more correctly, when your glucose or sugar, which is very similar, rises too high in your blood, it's the job of the insulin to bring that blood sugar down. So it monitors your sugar levels, because that can be a problem for your body if your sugar levels get too high. But it can also be a problem if your insulin gets too high. There's all sorts of other issues that can happen. Now, it's the job of your pancreas, your liver, and your adrenals to monitor your blood sugar and and to regulate the insulin levels in the blood. Now, what influences both of those, your blood sugar and your insulin, what influences that is, one of the things is the foods you eat. So if you eat foods that have too much sugar in them, or too much starch or refined carbs, then your refined carbs and your starch gets converted very quickly to sugar, and that can send your blood sugar levels up too high. And so, especially in the first thing in the morning when you haven't eaten all night. And we will be doing a separate webinar on sugar control, very important. And so we can you can look forward to that. So one of the keys to keeping your blood sugar under control is protein, especially first thing in the morning. So minimize your sugars, your refined carbs and your starches, and utilize your protein, not too much. You don't need a lot, just need a small amount. Now, the nutrients that are good for managing blood sugar are chromium and vanadium. And just to keep in mind, girls, sugar is public enemy number 1. So what are we saying here? We're saying is that if you have too much sugar in your diet, you could have too much insulin in your blood, and that will affect your hormone imbalance. Very simple. Secret number 4, stress. Now, stress affects your reproductive hormones. And guess what? Reproductive hormones affect stress, as you well know. You all know when your was, sorry, you all know when you know, and maybe others know too, when you're different times of the month, you are a different person. Sorry. Are you okay? I know you. I know. Hopefully, you can see the funny side of it. Now, we talked about the hypothalamus and the adrenal glands. They're both affected by stress, and of course, we said especially after menopause, then it's even more critical how they all interact. Now, we have the solution. We talked about the problem. Now we're going to look at the solution. Now, here's a summary of the hormone balancing nutrients. And these are all from the Zeta 8 range, and I declare I have a financial interest in that company. Now, Fulminate, which is actually trace minerals, and Regenerate will actually help detox your body and your liver. We call that the detox pack on the website. Then you've got Estra 8, which is actually helps to balance adrenals, blood sugar, and your hormones. We have Trimate, which actually helps balance blood sugar and cravings. Actually may help to increase your energy levels too. Invigorate, which is a super green powder, is actually good for the pituitary gland, and also may help your pituitary gland. I have to keep saying may because that's the legal requirement. May help your pituitary gland, and it also helps with the detoxing of the liver, and also provides raw materials for the liver to use. And Leanate, which is a protein and nutritional supplement, can also help you with blood sugar, and because it's protein, has the amino acids in it for your pituitary gland. There you go. We'll come back to that one in a moment. So, some case studies. Some time ago, I had a female patient who had a problem with hormone balance, which we were able to help. And she found once she reached a good level, she only needed to take 1 capsule a day of a detoxing herbal formula. And even that surprised me that was, and she was quite insistent that that's all she needed, and she felt fine. So just by taking that detoxing herbal supplement, she was able to keep her hormones balanced. Why? Because it was actually keeping her liver, helping her liver to stay on top of things, and obviously her liver was one of the factors in her problem. Now, normally in our clinic, we have a selection of remedies, and when we have a patient that manifests with a hormonal imbalance, we test them to see which of the selection of remedies that we have actually is going to work for that person. So without that advantage of getting tested, if you have that opportunity, great. If you don't have the opportunity, then you just have to use our protocols that we've recommended to actually help you with your problem. But there's no substitute for individual care. And I recall a time when I was doing a treatment for my teenage daughter. She was in her mid-teens, and for some reason I checked to see where the position of her uterus was, and you do this externally, not internally, so you don't get the wrong impression. And I picked up that she had a uterus drop, which, it can be inverted, retroverted. And I said to her, "Do you get painful periods?" She said, "Yes." I said, "How come you never told me?" She said, "Well, I thought it was normal." So apparently she used to get very painful periods, quite heavy, and sometimes very painful, and even clotting. And when I lifted the uterus again, using an external technique, just in the lower part of the stomach, we lifted the uterus. Her menstrual cycle improved. Her periods improved dramatically. Now, that's not going to work for everybody, but just shows you how often the position of the uterus can influence its function. And hello, we got a little spelling error there, if you can see that. So in the clinic, we've had numerous responses, and legal restrictions do restrict me from saying too many things, but let me just say that it's one of the most common things that I've treated over my 40 years of clinical experience. So the past hour or whatever, I hope you agree it's been time well spent so far, but I can't cover everything you need in an hour or even less in a webinar, even if we had all day. So I want to give you a special offer so you can get everything that you need to know. And if you act fast, I'm going to give you a very special deal just for those that are on the webinar. Now, changing habits can be hard, can be difficult. So the idea is to find a solution to help you change your habits. And the solution is a number of different options for you. So here's option one. This is a complete 3-month detox and hormone rebuilding program. So it takes a while to change all of these things. So month one is our detox pack, which actually helps the liver component, which we've already talked about. Then month two is the Extra 8 for adrenals, for blood sugar and hormones, and Trimmer 8 for blood sugar and cravings. Then month 3 is Invigorate for the pituitary gland and the liver, and Lena 8 for blood sugar and pituitary gland. So you're taking basically 2 products each month to do a complete hormone rebuilding program for yourself. And you may even find when you do this, your bloating will decrease, your energies will improve, you will improve, your weight will normalize, and so you'll get a lot of other benefits from doing this. So that's option one for you. And what you're going to get in option one is, we mentioned the detox pack, the Extra 8, the Trimmer 8, Vigor 8, Lean 8. That's a total cost of $345. But don't despair. I've got an offer for you. I'm going to throw in a bonus from Stress, Anxiety, Depression, and Fear to Life Empowerment Seminar Part 1 on video. That's for the first 30 people that respond to this offer on the webinar. And another bonus, which is Part 2 of the same topic. It's for the first 30 people only. Now, this is what you're going to get. All the things we just mentioned, which is a total value of $439. Now, if all this did balance your hormones, would it be worth it? If it did alleviate your symptoms, would it be worth it? So what's having your hormones balanced worth to you? If you were to spend that kind of money, would it be worth it to you to get out of your misery and improve the quality of your life? What if you had to spend $1,000 to do that? Would that be worth it to you? So, while you're thinking about that, I want to throw in another bonus, which is 7 Unknown Secrets of Weight Control on video DVD by yours truly. This is for the first 10 people who respond to the offer. So, this is what you're going to get. The Detox Pack, the Extra 8, the Trimmer 8, the Invigorate, the Lena 8, the bonus 1, the stress video, and part 2, bonus 2 is part 2 of the stress video, and bonus 3 is the weight control video. Total value of $486. So I'm going to give you a guarantee for 30 days. So if you get it today, and if you don't like it, within 30 days, just let me know and I'll give you your money back. I don't care if it's 1 minute less than the 30 days. I'm happy to give you your money back because my reputation is more important. If it doesn't work, and the reason I make the guarantee is because I know you'll be delighted with the results. But the real question is it worth making this small investment, which even if it does half of what I've claimed today on this webinar, will pay for itself tenfold. So you can get started by just going to my website and you'll see a little thing there on offer, which you can actually get a deal on. This is what you're going to get. I've already said that. But we're also going to throw in another bonus with Dr. Simon Vella, who will give you a complimentary consultation, whether that's by phone, whether that's by email, whether that's by FaceTime, whether that's personally in the clinic, to help you get started on your program and to do any testing that you might need. And that's actually valued at more than $97. It's over $100. That's for the first 5 people only. So putting all that together, that's actually what it's worth in real terms, $583. Now, option 1, we're going to give you a special webinar discount down to $275. So that's a saving of over $300 that you're making. But that's only for this webinar discount. Now, or if you don't want to make that kind of an investment, if you want to perhaps just dip your toe in the water, you have a different option. You can get the detox pack and the Extra 8, and that will be $144. That does not include the bonuses. And just go to the website and you'll see the Fulminate Regenerate Detox Pack and the Extra 8 in there, and you just order online for that. Or option 3, if you still, for whatever reason, do not want to go the whole hog, so to speak, you can just get the Extra 8, which will help balance your adrenals, your blood sugar, and your hormones for just $47. Again, this does not include the bonuses. And you order direct from my website. So let me show you what to do next. Either go to my website or you can click below, the link below, to get the option 1 special offer. So you want to get started now, that's what you click on. So you can get started now for just $275 today to actually balance your hormones naturally without drugs. So that's been 40 minutes, which I'm always happy to get it done under the hour. And if you want to type in any questions on the bar on the right-hand side, I will just go back and if I can find it, so I can see any questions that are coming in. Yep, great. So now, usually what I should have said was, if you have any questions during the webinar, please type them in, because there is a delay between when you type the question in and when I get it. So I hope that while I'm just waiting for your questions, I hope that's been helpful to you. And a lot of information, and you probably want to go through it again, which we will offer a replay on this webinar, so you can look at it more than once. And yes, okay, yeah, we usually get this. I should perhaps do a frequently asked questions section, but we often get asked this about dosages. The dosages are usually on the container. That, of course, is a guide. What we usually recommend with the Fulminate and the Regenerate is a teaspoon of each because one's a liquid and one's a powder. A teaspoon of each in whatever you like, water, or I'm a great fan of half water, half sparkling apple juice, because it helps to dissolve the powders and it also makes it taste a lot better. So half water, half sparkling apple juice. But you can get the one without any added preservatives or colorings or flavorings or sugar. I think Mountain Made is one. Used to call it apple cider, but apple cider now is all alcoholic, so it's now called sparkling apple juice. So, whatever you like. So a teaspoon of each, usually mixed in first thing in the morning, does the trick. If you're taking the Extra 8, again, usually a teaspoon a day is enough. And again, you can put it in water or in some sort of juice. I usually recommend with the Extra 8 to take it perhaps mid-morning or mid-afternoon, especially if you get an energy drop at any time of the day. That's a good time to use it because it'll help give you a bit of a pickup. Now, if you are a sensitive type of individual, then you may want to just do half dosage of whatever is recommended and just build it up naturally. If you don't find you're getting the result you would like in a couple of weeks, then I'd suggest you increase the dosage. So but go by what's on the pack, and with the Trimmer 8, which is good for, as we mentioned, for balancing your blood sugar and also cravings. It's usually a couple of teaspoons, and you put that in a fruit smoothie. Again, mid-afternoon, mid-morning, or before meals, or as a meal replacement. Before or after a workout is good. We often recommend, if you're taking a protein nutritional supplement, it's good to take it after a workout because it actually helps your body replace what it's lost and helps you recover quickly. So a pre-workout and a post-workout smoothie works quite well. If you're using a green powder, we recommend you putting it into a veggie juice. So if you're having a veggie juice in the morning, it's a good time to put your Invigorate in there, which is a super green multi-supplement. But again, you could have that pre-workout. So a Invigorate is good if you're doing a veggie juice, to work your Invigorate in there. I find some things you can mix, and some things you'll get a better result if you don't mix them together. There are exceptions. I mentioned the Fulminate and the Regenerate you can use together, but all of the other things, it's best just to have them separate at different times of the day, and you'll get a much better result. If you are pregnant, there's a question there. If you are pregnant, then I don't recommend you take any of these substances apart from. You could use maybe half dosage on the Regenerate and the Fulminate. You could do half dosage on those, and you could also use the Invigorate without any problem at all. But I certainly wouldn't recommend you use Extra 8 if you're pregnant. Now, also, the question here, breastfeeding. Again, I wouldn't use the Extra 8 during breastfeeding, especially for the first 12 months. Once the child's on solids, and you may still be breastfeeding, but once they're on solids, it's usually okay to start bringing in other things. But you're always better to consult with your practitioner on those things. The question, is another one here. What about if I'm already, taking medication, even, contraceptive medication? Look, you can if you're still having problems and you're on medication, certainly I would use this program anyway, in addition to your medication. But you may find once you start using natural methods, you can either reduce or you can phase out, and I emphasize that, you can phase out your medication with your doctor's approval. If he won't give his approval, then you have the choice of doing it yourself. Unfortunately, with doctors, because they don't always have a lot of experience or understanding with natural methods, it's easier for them just to tell you not to take it because they don't have the experience of how you work the two together. So I'm going to sign off now. I remember last time I signed off, there were still questions coming through, but I think you've had enough time to ask your questions. So thank you for being with me and attending this, what I feel is a very important informational webinar for you. And I look forward to seeing you on my next webinar. This is Dr. Bill signing off. Thank you for being with me. Bye.